Now we'll talk about another, how will I say, is this a sign or a symptom? It's a symptom, right? So we'll talk about the progressive loss of coordination. So it's actually one of the things that the patient might actually complain about, or if you are following up your patient for a very long time, the patient comes today, you ask them to do some one or two things, it's like this, the next day is declining. So you call that the progressive loss of coordination. So we'll talk about what it means and also the different disease conditions that it's actually associated with. So progressive loss of coordination is often referred to as what? Ataxia. So it's a neurological condition, and your brain center, that's what mostly the cerebellum is the one that is affected. So it usually worsens over time. That's why I say that it was, you say, progressive. It has to take time. So what it means, ataxia is the medical term for it. If you hear people all anytime saying ataxia, it also means progressive loss of coordination. So the movements are not steady, they are clumsy, they are awkward. So it indicates that the symptoms are worsening, and it often points to an underlying chronic, issue. So what are the disease conditions that this is associated with, which is the most important part of this lecture? It's associated with cerebral disorders. So damage or degeneration of the cerebellum, that's the brain's coordination hub. It's also associated with genetic conditions, like all those spinocerebellar ataxias and the Friedreich ataxia. It's associated with all those neurodegenerative diseases, like all those multiple system atrophy and Huntington's disease. So also associated with stroke, brain tumors, and multiple sclerosis. It's associated, it could be a side effect of some drugs. Okay, it could be a side effect of some drugs. So symptoms to watch out for include if the gait is becoming unsteady, it's clumsy, difficult to find motor tasks, like the person is able to write, buttoning clothes. Of course, these are the things that you're using to now access the patient anytime they come around. Then also speech changes, Okay, so that's what we got. Then eye movement problems, and you are checking those things time by time, and you are getting to see that okay, they're actually worsening with time. So diagnosis is a neurological examination. You're trying to access for balance, coordination, and reflex. You also image to now look at the cerebellum if it is affected. Genetic testings and also blood tests. So management is you always treat the underlying issue. Okay, supportive therapies like all those physical therapy, occupational therapies, speech therapies. The person will now use the person will now be having all those walking aids, the canes, the walkers, and the rest of it.